With many viruses, people often get the first cough or sniffles and just carry on, going to work or meeting with others. But with COVID-19, health officials emphasize the need to isolate quickly. And a new study explains why. Research in the Lancet microbe compared coronaviruses from previous outbreaks and finds that symptomatic patients diagnosed with COVID-19 had the highest levels of live virus in the first few days.
This virus, more so than a couple other viruses, seems in some patients to shed a lot of virus. So when you're sick, you're actually releasing a lot of virus, and that's always problematic for infection of other people.
The COVID-19 virus was most infectious very early, in the first 5 days after the onset of symptoms. With previous outbreaks years ago with SARS and MERS, the viral load peaked later. With MERS, 7 to 10 days after the onset of symptoms, and with SARS, 10 to 14 days later. So with those viruses, the symptoms would tip you off early and you could isolate before the infection was at its worst. But with COVID-19, the infectiousness is at its worst as soon as the symptoms appear, which is why COVID-19 is so hard to contain. Other studies have shown some COVID carriers are infectious before they show symptoms, making the spread even harder to contain.
And that's why we ask people when they've potentially had contact to self-isolate regardless of whether they're currently testing positive or not, because we're still missing that critical piece of information before you develop symptoms. While the virus spreads quickly, the Lancet research also found that no live virus remained in symptomatic patients after 9 days, so the infectiousness to others does drop off dramatically. One other new study says COVID carriers develop immunity that is now shown to last at least 6 months.
This is potentially significant news. It extends the period for which we know there is likely protection.
Evidence of a strong immune response gives researchers optimism that vaccines now in development will also have lasting immunity. Eric Sorsensen, Global News, Toronto.